Well, measles is a very contagious virus. It can make you really, really unwell. You can have a cough or a cold. You can develop a rash later. But sadly, 1 in 5, about 20% of children end up in hospital. And when they end up in hospital, the virus can affect your lungs, it can affect your brain, and those times it's particularly scary for the parent, but it can be really serious for the child too. And that's why it causes a lot of anxiety. Well, the complications are mainly they occur in the lungs, so they can cause pneumonia. It's a really bad disease affecting the lungs, and that can have long-term issues with the way you breathe or how well oxygen is getting around your body, and that can lead you into needing oxygen in the hospital. And very sadly, some children who get pneumonia due to measles end up in intensive care, and they need a machine to help them breathe. And that's a rare but a very, very important complication of measles. And the other big complication we see is measles affecting the brain. And measles can cause meningitis or encephalitis. These are two conditions that cause inflammation of the brain. And really sadly, 5 years, so years after developing the virus, you can develop an encephalitis, this inflammation of the brain, which just progresses and progresses and progresses. And very sadly, those children end up dying from the complications of measles. So the complications affects the lungs and the brain, and they can be really serious, and sadly, on occasions, they can be deadly too.